Breaking news from the desk of Nishika Jackson Ogilvie. Just released out of Africa, cholera remains endemic in Africa, although it has almost been completely eradicated in developed countries due to safe drinking water and advanced sanitation systems. Africa is still suffering from the seventh cholera pandemic, which is now ongoing over 60 years since 1961. 1.3 billion persons are at risk in the sub-Saharan African area of getting cholera. According to the World Health Organization, in 2021, 1.3 to 4 million cases of cholera were reported. 21,000 to 143,000 deaths worldwide. Since 1970, Africa has reported more cholera cases and more cholera deaths than any other region, which represents 46% of all cases globally. The cholera is a bacterial infection caused by the enterotoxin produced from a common-shaped gram-negative bacillus called Vibrio cholerae 01 or 0139, which spreads through contaminated food and water. It is an infection of the small intestines. Symptoms could range from none to mild to severe. The symptoms are severe acute diarrhea, muscle cramps, fatigue, weakness, nausea and vomiting, dehydration, electrolyte imbalance, low blood pressure, loose skin, dry mouth, rapid heartbeat, and weight loss. The most common and life-threatening complication of cholera is severe volume depletion, leading to hypovolemic shock and metabolic acidosis. Acute cholera can lead to death if not treated within 12 hours of first symptom. In order for an outbreak, there must be three factors present. There must be an agent, a host, and an ideal environment. The agent is Vibrio cholerae 01 or 039. The host is a susceptible human, and the environment must be unsanitary conditions. Studies have shown that cholera outbreaks are also seasonal. It tends to increase during periods of elevated temperature with high evaporation, causing water to be stagnant. The bacteria can also be spread during periods of high rainfalls and flooding, which could damage wash infrastructure and cause unsanitary condition by mixing of overflowing sewage with floodwater. Cholera is considered to be hyperinfectious for at least 5 hours after passage from the human host into an aquatic environment, which means contact with another host must be done within a short period of time to cause spread, which indicates open defecation and unsanitary condition is a major spreader of the disease. It has also been shown that genetics appear to play a significant role in a person's susceptibility to cholera. Persons with H blood group and persons with retina vitamin A deficiency appears to be more susceptible. The O prototype appears to be more resistive to Vibrio cholerae. However, if becomes infected, appear to have a greater severity of symptoms. Severe cholera has also been associated with persons having a conserved innate immunity protein gene called lung palate, lung and nasal, epididymal, epithelium carcinoma associated protein. Cholera is a completely preventable disease if resources are put in place for water sanitation and hygiene. Infrastructure, education, and vaccination. Persons who have previous Viridae cholerae infection had a 90% chance of not getting reinfected from subsequent outbreaks. Cholera induced a memory B cell response detectable for at least 1 year after cholera infection. They have also identified the serum virucidal antibody titer in a person between the age of 10 to 15, indicating previous exposure and herd immunity. Research have shown that cholera could be controlled in endemic area if only 50% of the population gets vaccinated. It is recommended that travelers to endemic areas be vaccinated. There ends the breaking news on cholera from the desk of Nishika Jackson Ogilvie.